Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mrs. Sarah. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm really sorry to hear about that, Mrs. Sarah, and I understand that being parent, how difficult situation would be for you. But before I come to the management part, I need to ask you a few questions regarding all these conditions. Is it okay with you? So, Mrs. Sarah, if Ali is accompanying you today, it would have been better if he could accompany you so that I could have examined him. But it's okay, Mrs. Sarah. May I know the exact age of Ali? All right. Okay. All right, Mrs. Sarah. So, what prompted you to have this growth chart done? Okay. All right, Mrs. Sarah. What was the mode of delivery? If you had any complication before during giving birth to Ali? If he was full term? May I know his weight when he was born? Okay. If he cried immediately? All right, Mrs. Sarah. Is his all vaccination done according to his schedule? If he has any problem with immunization? All right, Mrs. Sarah. So what type of feed he is taking? If he's on breastfeed, formula, if you have started any solid food. All right, Mrs. Sarah, are you following manufacturer instructions for preparing milk? Has he achieved his development milestones for his age and time? Okay. All right, Mrs. Sarah. So, how about sun exposure? That's great. Okay, so Mrs. Sarah, if he is Pella, okay. If he becomes short of breath when you feed him, feel lethargic. Okay. All right, Mrs. Sarah. If Ali is suffering from any medical condition, neck gland problem, high blood sugar. All right. If he has any wheat allergy. How about his bowel habits, Mrs. Sarah? If his bowel habits are normal, may I know the stool consistency? Have you noticed that his stool is greasy? Have you noticed that he has a diarrhea following wheat when you give wheaty? Right. Right, Mrs. Sarah. If he has his abdomen is distended, may I know if his hair color has changed? Have you noticed any difficulty in breathing while he is feeding? Okay. Have you noticed that he throw out milk as soon after feeding? Okay. Vomit. Okay. So if it is mild or projectile. And how about his urine, Mrs. Sarah? Okay. If he had any recurrent infections. Okay. How often do you feed him? And how much fluid does he take daily? Are meals regular and balanced? Okay. Right, Mrs. Sarah, what do you do for a living? Okay. And so who look after him when you are at school? Okay. Are you sure that he are getting adequate diet when you are at school? If she is feeding properly? All right, Mrs. Sarah. So, if you had any infection while you are pregnant? Okay. Do you have any neck gland problem? Diabetes? And which weather do you like the most? Okay. Okay, how's everything at home? Are you taking any medication prescribed by doctor over the counter? If there is any family history of short stature? All right, Mrs. Sarah. What are your concerns? What worries you the most? I understand, Mrs. Sarah. You need not to be worried. I'm here to explain, okay? And I'll try best of my abilities to solve this problem, okay? How it sounds to you, Mrs. Sarah? All right, Mrs. Sarah, it would have been better if he could accompany you so that I could have examined him. So I'll ask few questions, okay? So have you noticed any frontal bulging on his forehead? How his chest looks like? Have you noticed that it is like a pigeon shaft? Have you noticed that wrists are widening? Any bowing of his legs? All right, Mrs. Sarah. The history you have shared and question I've asked, okay? I came to the conclusion that most probably checking a growth chart, I came to the conclusion that Ali is suffering from failure to thrive, okay? But let me reassure you that there is no underlying disease, okay? It is due to nutritional deficiencies, okay? If it makes sense to you, Mrs. Sarah? Yes, Mrs. Sarah, actually, the milk you were giving was over-diluted, okay? Let me teach you, okay? If you are adding 1 spoon of milk, okay, and then add 30 ml of water, okay. If 2 spoon of milk, then 60 ml, okay. So for each spoon, add 30 ml, okay, and it's the proper dilution for milk, okay. And besides that, I'll encourage you to wash your hands thoroughly before preparing feed, okay. And I'll encourage you to sterilize bottle. Sterilizers are freely available in market, okay. And prepare milk by add right amount of powder to right amount of water, okay. If it makes sense to you, Mrs. Sarah. Yes, Mrs. Sarah, there's no feeding time for child. Should be feed on demand, but should be given 2 to 3 hours interval Okay, child give time to digest and feed. Okay, so prop up the child after feed and wrap. Okay, and besides that, Mrs. Farah, I'll encourage you to exclusive breastfeed if you can. Okay, and besides that, I'll refer Ali to dietitian. Okay, and dietitian will teach you the proper diet for Ali. Okay, and I'll encourage you to give him a banana, mashed banana. Okay, and mashed potatoes. Add some cream. Okay, and butter to mashed potatoes. Okay, and you can give him egg white. Okay, and as you stated that you have to look after everything. So I'll give you contacts of some social workers. Okay, they can help you to arrange food as well, if it makes sense to you, Mrs. Sarah. If there is anything else you want to discuss with me today. All right, Mrs. Sarah, here is a leaflet. It includes all the information regarding condition, and I hope it will be helpful for you. Okay, I wish him happy and healthy life. Okay, take care. Bye-bye.